In the previous parts, we understood the process, how plaque builds, how arteries close, how heart attacks happen. Now we answer the most important question. Can it be prevented? Yes, in most cases, it can. Heart disease does not appear overnight. It develops slowly, over years, sometimes decades. Plaque does not suddenly form. Risk accumulates quietly, which means prevention also works quietly. Prevention is not dramatic. It is not extreme dieting. It is not punishment. It is daily decisions. What you eat, how you move, how you sleep, how you manage stress. Small habits shape artery health. There are 5 major levers that control heart risk: cholesterol, blood sugar, blood pressure, inflammation, and visceral fat. If you control these 5, you control most of your risk. LDL cholesterol enters the artery wall. Over time, it builds plaque. Lower LDL means slower buildup. Stable plaque is less likely to rupture. Cholesterol control is not about fear. It is about stability. High blood sugar damages artery walls. Insulin resistance increases inflammation. Even without diabetes, mildly elevated sugar accelerates plaque growth. Stable glucose protects vessels. Unstable glucose irritates them. Blood pressure is mechanical force. When pressure stays high, it stresses the artery wall. Microinjuries form. LDL enters more easily. Plaque builds faster. Control pressure. Protect the lining. Inflammation makes plaque unstable. It weakens the protective cap. Smoking, chronic stress, poor sleep, excess sugar, all increase inflammation. Calm the system. Stabilize the plaque. Not all body fat is equal. Visceral fat surrounds internal organs. It is metabolically active. It releases inflammatory signals. It increases insulin resistance. It raises blood pressure. A flat stomach does not guarantee low visceral fat. Internal health matters more than appearance. Visceral fat does not stay quiet. It sends chemical signals into the bloodstream. Those signals reach the arteries. They increase inflammation. They weaken plaque stability. Reducing visceral fat reduces internal stress on your arteries. Prevention begins with food structure, not extreme restriction, not elimination of everything. Whole foods, fiber, healthy fats, moderate portions, food that stabilizes glucose and reduces inflammation, supports artery health. Large sugar spikes damage vessels. Repeated spikes increase oxidative stress. They promote inflammation. They accelerate plaque formation. Stable blood sugar means stable arteries. Consistency protects the vessel wall. Late-night eating disrupts metabolism. Insulin response changes. Blood sugar control weakens. A consistent eating window improves metabolic stability. Even a simple 12-hour eating window can support hormonal balance. Movement is not optional. It improves insulin sensitivity. It lowers blood pressure. It reduces inflammation. You do not need extreme workouts. Regular walking, 8,000 to 10,000 steps, makes measurable difference. Muscle tissue is a glucose reservoir. More muscle means better sugar control. Strength training improves metabolic flexibility. It reduces insulin resistance. Muscle protects arteries indirectly through metabolism. Sleep is biological repair. During deep sleep, hormones reset. Inflammation decreases. Blood pressure stabilizes. Chronic sleep loss raises cortisol, increases insulin resistance, elevates blood pressure. Rest is cardiovascular medicine. Stress is not just emotional. It is biological. Chronic stress raises cortisol. Cortisol increases blood pressure. It worsens insulin resistance. It promotes inflammation. Occasional stress is normal. Chronic stress is vascular strain. Morning sunlight anchors your internal clock. Circadian rhythm regulates hormones. Blood pressure patterns. Glucose control. Natural light in the morning improves sleep quality. At night, small exposure. Daily consistency. System-level benefit. Smoking directly damages the artery lining. It increases oxidative stress. It makes plaque unstable. It thickens blood. There is no safe level for vascular health. Stopping smoking rapidly lowers risk. Arteries respond faster than most people think. Alcohol is dose-dependent. Small amounts may not dramatically increase risk. Excess consumption raises blood pressure, worsens triglycerides, increases inflammation. Moderation is the principle, not elimination, not excess. Supplements are not shortcuts. Omega-3 may help in specific conditions. Vitamin D helps if deficient, but no supplement replaces lifestyle. Artery stability comes from patterns, not pills alone. For some people, lifestyle alone is enough. If LDL is mildly elevated, blood pressure controlled, glucose stable, and inflammation low, diet and movement may correct risk without medication. For others, risk is high. Genetics matter. Family history matters. Severely elevated LDL cannot always be fixed by lifestyle alone. In those cases, statins stabilize plaque. Medication is protection, not failure. Prevention is not a 30-day challenge. It is long-term consistency. Balanced food, regular movement, stable sleep, controlled stress, appropriate medication when needed, small daily actions compound over decades. Prevention is not guesswork. It is measurable. LDL, ApoB, HbA1c, blood pressure, triglycerides. Numbers tell a story long before symptoms appear. If you are healthy, testing once a year may be enough. If risk is higher, testing may be needed every 3 to 6 months. Monitoring trends is more important than a single result. One abnormal value does not define you, but persistent elevation increases risk. When numbers improve consistently over time, plaque becomes more stable, risk decreases, consistency changes outcomes. Lowering LDL reduces plaque growth, controlling blood pressure reduces vessel stress, stabilizing glucose reduces inflammation. Risk reduction is not theoretical, it is biological. Arteries respond to improved environment. Genetics influence risk, but genes are not destiny. Environment, lifestyle, medication when needed. These modify genetic risk. You are not powerless. Genetics influence risk, but genes are not destiny. Environment, lifestyle, medication when needed. These modify genetic risk. You are not powerless. The heart attack is the final stage of a long process. Understand the process. Measure the risk. Act early. Stay consistent. That is prevention. If this series helped you understand how heart disease develops and how to prevent it, please like the video. It helps this information reach more people. Subscribe so you never miss future medical deep dives. Explain simply and share this with someone you care about, because prevention works best before an emergency begins.